Yes, I'm Joe Maroon. I'm a professor of neurosurgery at the University of Pittsburgh and the team neurosurgeon for the Pittsburgh Steelers. The current policy is any transient disturbance of neurological function, which by definition is a concussion, is reason to not let the athlete return to contact at that time. The role of the neurosurgeon in addressing sports injuries is quite multifactorial, as you would anticipate. Number one, it's to prevent injuries. In actuality, the most important thing we do is we diagnose the problem when it occurs, such as a concussion, and then managing it appropriately, which means evaluating and testing the patient and making sure they don't have any intracranial problems, and then doing appropriate tests such as the impact neurocognitive test, to assess their processing of information, their reflex speed, and their memory prior to returning to any contact sports. I think it's terribly important. Hippocrates said that the first responsibility of a physician is to prevent disease. So what does that mean in concussion? Basically, we need to continue to put emphasis on the pre-contact, pre-season baseline testing to obtain neurocognitive information that can be used if there is a concussion to compare against the baseline test and know exactly, or as exactly as we can, where the athlete stands relative to his processing of information, his memory, and his reflex time. So the pre-testing with impact, which is the neuropsychological test, the management, the diagnosis, and then the treatment is one of primarily preventing the athlete from returning too soon, then addressing the vestibular problems, the ocular problems that occur, the headaches, and the post-concussion syndrome.